we're now in the gallery that covers surgery and the history of surgical subspecialties. The first thing I want to share with you is when in the 1900 or even before, they believed that an infection or disease is caused from bad blood, and the first thing that they did was to bleed the patient and get rid of the bad blood. And this was the oldest way of doing it, is to put this against this area here against the neck, make an incision and get the blood to run and be collected in the deep part of this. As a matter of fact, you could find this in some of the barbers' stores that they did this job. The other one that did the same thing is making incisions using this little machine, which is a breakthrough from the earlier one. And if you look closely, you can see that there are blades here, multiple blades, 3, 6, and 6, 12 blades, that you load them like this, and then you let them go, and it will make an incision, small incisions, and the blood will start coming out. After they did that, they either collected the blood and threw it away, or used the cupping. And the cupping, this is a complete set that is very unusual to have a complete set, but it came with this device here and the cups. So what they did, they got a piece of cotton with alcohol and with a match, get it next against the back of the patient if that patient has pneumonia. And the theory was in pneumonia, there's a lot of congestion in the lungs, and this here, after you scarified the skin, will suck the blood out and relieve the congestion. And you don't have to cut the skin, because they also used it causing a bump, a raised area in the skin where this sits, and the blood will accumulate in that area. And they usually use about 6 or 8 of them in the same time. So the whole back will be full with circles and very congested skin. The surgery underwent tremendous progress. This is an old surgical set, and the reason we know that it's very old is all the handles are made of ivory. I think they stopped the ivory around 1890 or something around that date. But it has the hooks, the knives, and everything. It's a complete set, and it has additional instruments underneath this here. You can have more instruments here, and there are even more instruments underneath this tray here. So this is a complete set that the physician or the surgeon will take it around and treat the patients in their own home. During the Civil War, any injury to a leg or an arm, the limb will get gangrenous, and the bacteria will spread throughout the body, and very shortly after, the patient will die. So what they did, amputation was a big thing. I mean, right away, if there's an injury of the leg, the first thing they do, they amputate that leg. And this is an amputation set. And as you can see, it's a little bit gross, but that's how they did it. There was no anesthesia. They gave the patient or the injured soldier a couple shots of whiskey. It sat on that person, and very, very quickly used knives like this, a big knife. This is ebony handle. Cut all the soft tissue, and then they go from there and get the saw and saw the bone. And then what they did to stop the bleeding is to get like hot tar on the stump to stop the bleeding. But that's the state of the art at that time. That's how they took care of it. So after that, around 1850, the first general anesthesia operation was done in Philadelphia. And as a matter of fact, I visited the Ether Surgical Theater in Philadelphia. And what they did is they used this ether mask. It has the mask, to put on the patient's face, and then what you do, you just open the lid here, and you drip ether from the ether bottle till the patient goes to sleep. That was a big breakthrough. It took away the pain. However, ether is not safe. Ether can cause cardiac arrest, arrhythmias, and the death percentage was high. Then they came up with something new, the chloroform. And this is a chloroform mask. You put the mask on the face and you put some kind of pad on top of it here and drip the chloroform the same way they did for the ether. This is older, looks more sophisticated, but they did the same thing. Subspecialties in these galleries, there is neurosurgical instruments, and I chose few just to share with you. This is a reflex hammer. It's all made of wood, does the same job as a modern one to seek the reflex. Also, I want to share this with you. This is to do in the sole of the foot, Babinski, to see the reaction. And this happened to be not very sharp, but that's what will elicit Babinski reaction, and it's made of ivory. One more thing from the neurosurgical collection is this, what they call the circular saw. If a patient had subdural hematoma and the hematoma is getting larger and start to press against the brain, they would just cut the soft tissue and on the skull just move it back and forth, make a piece of bone, circular bone will come out. They used to call it the biscuit, and drain the blood. The last thing I want to share with you is an OBGYN set. Again, this is a complete set that an obstetrician will have everything he or she needs. It has it's well preserved. I remember I bought this years ago in 2001 from Christie's in New York, and still can be functional today.